when we're young, we can get away with like not really doing much for our bodies, right? Like you could stay up all night, you could eat unhealthy, but by middle age, it starts to catch up where the body's going to start to, hey, you know, check this out. This isn't working for us anymore. And kind of a reminder to circle back to some healthier habits. On this podcast, we explore health from the inside out, starting with foundations, connection, and the conditions that allow the body to heal. I'm your host, Dr. Emily Rottersheimer, and today I have a very special guest, Dr. Joseph Ruane. Dr. Ruane is the medical director of the McConnell Spine, Sport, and Joint Center in Columbus, Ohio. He specializes in the non surgical management of common orthopedic conditions. He is board certified in family medicine with a fellowship and focus in sports medicine, and he serves as an assistant clinical professor of sports medicine at the Ohio University College of Osteopathic Medicine. That's how I got to know Dr. Ruane. And he serves as head team physician for the Columbus Blue Jackets hockey team. And Dr. Ruane's practice is dedicated to comprehensive non-surgical musculoskeletal care with special interest in regenerative medicine treatments. His current research activities include the effects of stem cell therapy for osteoarthritis. So glad to have you here, Dr. Ruane.
What a mouthful, and boy, you did really well with that. Thank you so much, and thank you so much for having me.
You're welcome. You know, it's so funny because I was thinking about this podcast today and thinking about how long I've known you. So I met you when I was a resident, a family practice resident. I did my training, and part of the training is you do rotations. And I did my sports medicine rotation, spent time with you in your practice, and so that was over 20 years ago.
Yeah, we won't say that. We won't talk about that. That's remarkable. Wow.
Isn't that wild? Yeah, yeah.
Yeah.
And I just share with the listeners that, you know, during that training, it's a lot of like you get thrown into different offices, different doctors, kind of get to have to pick up on how each one, you know, works and what they want to see and everything. And I knew right from day one when I started in your office that this was a very different experience. And, you know, I could see the care that you had for your patients as well as for the students that came through your office. So that's just a heartfelt thank you. And then as well, you know, you've taken care of me and my joints along the way too. So I've gotten to experience you as a teacher and as my physician and as a friend now. So
Thank you for
thank you.
all of that. It's been my pleasure.
Well, let's get started because I think you are what you do is so crucial and so powerful. And I want to make a delineation because I think a lot of, you know, I hear from so many different people, whether it's in my life or like clients or whatever, who, oh, you know, I hurt my knee or I hurt my shoulder. I'm going to go to the orthopedic doctor. You know, and that seems like the kind of the knee jerk reaction is like I need the orthopedic doctor. And I try to stop everyone in their tracks right there and say, wait. Have you thought about sports medicine? So can you tell us kind of what's the distinction or why would somebody maybe want to start with sports medicine before going to an orthopedic doctor?
Yeah, what a great, no, a common question. You know, if you really think about it, medicine these days, let's start with your options. So if you get hurt, you can go to your primary care doctor, who is so skilled and can do so many things. However, much of their time right now is burdened with managing complex diseases, cardiovascular disease, diabetes, hypertension, anxiety, and a lot of that is overwhelming. And by the time the patient gets to, oh, by the way, my knee, my back, my shoulder, they like want to throw their hands up, right? And say, as you say, go to the orthopedist. On the other hand, now we have the orthopedic surgeons who have highly evolved their art over the years, and they really want to do what they do best, which is orthopedic surgery. And if you do not have a surgical complaint or a surgical problem, which the interesting thing is about 90% of orthopedic problems do not need surgery, sometimes you get that sense that the surgeon is just like, well, I can't help you. You know,
Mm-hmm.
there's not much more I could do for you. Maybe we'll do some therapy, we'll do some medication, and that's it. Well, over the years, an entire spectrum of treatment opportunities have evolved between those two spots, between your primary care doctor and the orthopedic surgeon. Years ago, as you referenced, it was years ago, um, when I started, we had just a few tools in our pocket. It was, physical therapy. As an osteopath, I do a lot of hands-on treatment.
Mhm.
There were some new medications coming, but over the years, we have things like ultrasound guided procedures and platelet rich plasma and stem cells and many things that can kind of stimulate the body, help the body heal, or provide options that are non surgical.
Awesome. I love that. I did not know that statistic that 90% of orthopedic conditions don't need surgery. So really 90% of the time it's more appropriate to start with a sports medicine doctor. So thanks for clearing that up. I would love to talk a little bit about if you could help the listener understand the importance of kind of rehabbing an injury that's maybe not going away within the first few weeks and not letting that linger. Like that's another place where I'm like, oh, we can't just wait.
Yeah.
We can wait a little bit, but we don't want to wait forever because what happens when we don't really try to rehab a certain injury?
And that's another kind of sweet spot for the sports medicine doctor is just a little bit broader knowledge and understanding of the musculoskeletal system.
Mhm.
A lot of times a patient will come in and say, well, I hurt my ankle and I looked online and I did some exercises and I'm no better, right?
Yeah.
And it'll be the question from us is, all right, let's talk about those exercises. What did you do? What couldn't you do? So the question you're asking is, what is the importance of doing proper therapy after an
Mhm.
injury? If you hurt your ankle and you limp around for a while, two things happen. Number one, and I know it sounds funny, but your ankle forgets how to behave normally. We
Mhm.
have nerves in our joints and in parts of our body called proprioceptors. And what those are doing are constantly keeping an eye on the environment, watching what's going on around us, even though consciously you're not thinking about it. Meaning, when you step off the curb, with a healthy ankle, your ankle feels that and it corrects itself so you don't roll off and hurt yourself. Well, when you get an ankle injury, that sense gets disturbed, it gets injured, it gets short circuited, if you will. And if you do not retrain that properly, that sense of instability, that sense of I don't trust my joints can persist without proper
Mhm.
rehabilitation. The other part of that is the limping around. While you're limping around, you're learning bad habits. You're putting stress on other muscles and tissues and tendons, and those are also remembering all that. Now all of a sudden you've got pain in your hamstring or pain in your calf, and you're wondering what is going on. And the body's connected, and if there's a problem in one area that's not being addressed, it's going to translate up to other areas over time. So rehabbing, recorrecting those bad habits, retraining the body, retraining the nervous system, very important early on.
Excellent. That's excellent. Yes. And like you said, it's all connected and everything is interacting with everything else. So that one, it's not just that one ankle, it's the whole system. So that's really important. And so can most of my listeners, I would say, are women about my age, kind of perimenopausal, menopausal. And can you share with us some of the maybe more common mistakes that you see women of this age making when they're trying to maintain their musculoskeletal health?
Um, I'm going to be honest. I think one of the more common things we encounter is someone who comes in with a bit of a presupposition of what they thought their problem was, because
Mhm.
now information is everywhere, and you're encountering that, right? And we all hear
Mhm.
the phrase Dr. Google and so on
Yeah.
and so forth. And I'm not knocking that. I think it's important. I think we believe in empowered patients.
Yes.
Knowledge is power. Uh, but access to all this information has given folks the ability to go down the line thinking about what's wrong with them. And I frequently hear, well, I have, or I think I have, or my massage therapist told me, and now they have been spending time maybe working on something that was not helpful for them
Mhm.
or basically just wasting time. So
Yeah.
believe it or not, I'm going to say one of the more common things is get a diagnosis early. Don't wait too long to figure out what it is, because kind of connected to your previous question, um, If the body learns bad habits or if you don't fix it early, it's going to end up causing other more widespread problems later. I would say the other thing with the perimenopausal women, and thank goodness there are folks like you, is it is really important at this time in your lives to check your vitamin D.
Yes.
You know, maybe check your hormone level. Hormones play such an important role in healing. When there is
Mhm.
imbalance in hormones, when things are too far to one side or another, that all affects how our tissues heal and respond. Women who are struggling maybe with their periods or menstruation may have issues with iron and other things like that. So getting baseline labs, getting your vitamin D checked, getting your hormones checked, all important to the healing process.
Excellent. Yes. So good. So good. I think it can be a time of life when it's like this is how I see it. I don't know if you would agree with me, but when we're young, we can get away with like not really doing much for our bodies, right? Like you could stay up all night, you could eat unhealthy, but by middle age, it starts to catch up where the body's going to start to, hey, you know, check this out. This isn't working for us anymore. And kind of a reminder to circle back to some healthier habits.
Folks may have seen that study that was out a little while ago about three major inflection points in our life as far as our health. And basically, it's 20, 40, 60. And at 20, we're unbreakable, as you're mentioning, and everything is great. But
Miss those
it's at,
days.
it was wonderful, wasn't it? It was, but it's at 40 when things start to change.
Yeah.
Metabolism starts to change.
Yes.
Our tissue healing response starts to slow
Mhm.
down. There's a little bit of a saying we use in sports medicine: what takes a week when you're 20 takes 2 weeks when you're 30, takes 3 weeks when you're 40. So
Interesting.
we hear a lot at 40 and 50 years old. Well, I had this when I was 20, and why isn't we face that question? Why isn't it going away like it used to?
Yeah.
So
Yeah.
absolutely, things start to change at that time, and again, we need to take it on as it comes.
Yeah. Well, I think that leads perfectly into the next question, which is really I'd love for you because you have a special focus on regenerative medicine and you utilize a lot of regenerative therapies in your practice, which I don't think is always the case with sports medicine doctors. Maybe you can correct me on that. I think you have a special interest in that. And so, can you tell us what that means? What is regenerative medicine and what are these therapies that you utilize?
Okay, we could take up the rest of the time with this because it is a special interest. It's a growing area. It's the future. There are so many
Yes.
things happening down this avenue. But I do want to tell you what it is and what it isn't. I think that's really important for folks to hear. Um, Number one, you asked, is everyone doing it? No, not yet. It is a niche. It is still something you can't find everywhere. And you want to find a provider who is qualified and experienced, meaning, and we see this happening now in weight loss clinics, in
Mm,
aesthetic clinic, things pop up that aren't really scientifically medically based. So be careful with places that are claiming to be stem cell clinics or regenerative clinics. Just look into the background, see what's behind the curtain, and find a qualified provider. That's very important.
yes.
Um, Now, what is it?
Mhm.
The body has an amazing ability to heal itself. We know that, you
Yes.
know that, right? I tell folks, if you think about what happens when you break a bone, two bones are separated. Blood shows up first, inspects what's going on, creates a little hematoma or blood blister, if you will, around that break. And then the body calls in everything it needs to heal the bone. All the tools, all the
Mm,
cells, all the healing. It's a phenomenal event that occurs. It's really pretty cool. We are learning now how to hijack that a little bit. And the number one tool we use for that is something called PRP, or platelet rich plasma. And that's when we take a blood sample and we can concentrate those vital chemicals that are in the blood, mostly platelets,
mhm,
that are involved in the healing response. We concentrate that to about 8 times, maybe 10 times the body's natural healing power, and we can put that in places that are being stubborn, like a tendon that won't heal,
mm,
or maybe early arthritis, or an old muscle tear. As we said, Things slow down when you're 40 and 50
Hmm.
years old. The healing response is not the same. So we can augment that with this stuff called PRP, which we do right in the office. We take your blood, we process it in a sterile environment, and it's given back to you, if you will, under ultrasound guidance, precisely to the point where you're having the problem.
Wow.
Yeah, it has been one of the best tools that have been developed over the past decade. And the cool thing is, it is legit, meaning studies are now behind this, proving that this is. American Academy of Orthopedic Surgeons had an editorial statement saying this should be first line treatment for early osteoarthritis.
Wow.
Yeah, yes. It is for anyone out there who has been diagnosed with arthritis. It can help your pain. It can improve stiffness. It can improve your function. And what we've learned in the last 2 years or so that's really neat, it actually slows down the arthritis process. It is a true
Amazing.
disease modifying treatment, which is the first of its kind. It's the holy grail, right? Well, the holy
Yeah.
grail is going to be regrowing cartilage.
Oh,
That's the end of the discussion.
oh,
But as far as treating arthritis, it's one of the best things that's come along, and it's your own blood. Now,
that's phenomenal.
it really is. Now, before everybody lines up and goes, um, understand it is still because insurance will call it quote experimental, and it's not covered by insurance plans, and so it's an out-of-pocket expense depending on where you go.
Sure. Got it.
Going down the line, I will try and briefly give an overview of stem cell therapy. We get stem cells now from you, from your body, and they come from either bone marrow or more recently, our fat cells, believe it or not. Believe it or not. Fat, we know for a long time, and a lot of your listeners know that fat has been deemed bad, right? It's inflammatory.
Mhm.
But if it's inflammatory, it means it's metabolic tissue. So it's not only inflammatory, there are positive things about fat. And part of that is it is a remarkable repository or storage site for regenerative cells that's been discovered. So we can take a little fat out and process it right in the office and liberate or free those regenerative cells and use it again as a treatment for arthritis or tendon tears and things like that. Again, really, really cool stuff. It's not perfect and it's not a miracle. All
Sure.
right. We haven't found the cure for these things yet. We're not curing arthritis. We are fixing some tendon tears. We are getting nice results from some of this, but it's still a road we're going down and learning a lot as we go
Sure.
down that road.
That's amazing. It's just so refreshing to have some new treatment options that are actually just utilizing the body's innate healing capacity, which is just the body's not healing as quick of a rate, but we can boost it or help it along that, like you saying. That's I love that. Um,
Sometimes it just needs a jump start. It just
mm,
needs to be reminded what it can do.
yeah.
And that's part of it. And other things that are coming in, just to mention, because again, your listeners may be hearing about it, shockwave therapy, which has been around a long time, but now the technology has been improved so we can use it in the office. Shockwave uses high energy sound waves or shock waves to stimulate tissue and to stimulate mitochondria in improving itself. And now the latest thing in sports medicine is lasers are back. We're looking at your folks may ask about red light therapy.
Mm-hmm.
Red light therapy is also legit, but it's got to be medical grade red light. A box you buy on Amazon is not going to cut it. There are certain wavelengths and certain intensities that have to be delivered by a fairly more expensive machine. But these things can improve tissue health, they improve mitochondrial function, they improve blood flow, and they are beneficial. So these are all tools that are coming together now to
Yeah.
look at different ways to help the body.
Wow. That's there's so much hope in that, right? I think that the thing that one of the things that drives me crazy about kind of the media and the way our society is set up is that we're just expected to age and be debilitated, right? Like aging is just this gradual, like, you're going to end up in a wheelchair or unable to take care of yourself. And we have so many tools now that aging doesn't have to be this horrible, terrible thing that ends in a nursing home if we take care of ourselves. So
I've
um
tried to eliminate that phrase from my practice, because people, it's true. People will hear, well, you're just getting old.
yeah, Yeah, yeah.
And so I'll say, okay, and now what? Right? What are we going to do about it?
Right.
But then going back, the most important thing to do about it is what myself and you, to be honest, are doing now is optimizing your health in your
Mhm.
early years.
Yeah.
And from your standpoint, it's nutrition and gut health and
Mhm.
biochemistry. From my standpoint, it is exercise and muscle mass. I mean,
Yeah.
building muscle for your listeners.
Yes.
And when I say muscle, don't worry, I'm not talking about big biceps.
Mhm.
I'm talking about optimizing your strength and your muscle is one of the most
Yes.
important things you can do to age well later on.
I love it. Well, that was kind of leading into my next question was how do you suggest we care for ourselves as we age? And maybe you can talk a little bit more specifically about what would a strength training, like what kind of, regimen would you suggest, or what do you recommend to your clients as far as maintaining that muscle?
Yeah, the first and hard thing these days is getting the habit going,
Mm.
right? Especially for
Yes.
someone who's not, if we're encountering someone who's not exercising and in their mind they either have a gym or an hour a day or sweat or all this stuff, and
Yeah.
that's not what it takes. That's not the starting point. And the really first thing I do is negotiate it down and say, where are we starting? What feels good to you? What will you do? What do
Mm.
you enjoy doing, right? What do you like doing?
Yeah.
Let's start there. And goal number one is just let's get your body moving more than it was yesterday. That's one of the most important things to me.
That's
All
good.
right.
Yeah.
And then next week we'll talk about moving more than you were last week. And the week after we'll talk about moving more. And just putting your body in motion is so
Mm.
important as step one, no matter what it is. And then you could begin with simple stuff, things you could do at home. I love TheraBands and rubber bands. They're fantastic. They're
Great.
home, they're easy. You don't have to go anywhere. They provide resistance in two directions, which means you're
Mm.
working, the both sides of the muscle groups at the same time.
Sure.
And they just give you a really nice, thorough kind of, and you could do a full body workout with a bunch of rubber bands you could buy. And now all the instructions are online and
Right.
everything.
Right.
And let's do 10 minutes at first. All right, just try it out.
Yeah.
Don't hurt yourself. There's no big program. We're going to starting small is important and
Mhm.
take little bites, right? Because then you know what happens, and you see this happen all the time. The patient will get to that point where they go, you know what? I kind of like this, right? I want it. You start
Yes.
to get, you can't escape the benefits of exercise. The
Yeah.
benefits of going from nothing or little to something are bigger than the someone who is tweaking their program. Those people that are exercising 4 or 5 times a week and
Yeah.
optimizing their cardio, they're getting this much gain. The person that's going from
Mhm.
nothing to whatever is getting this much gain. And
I
it's
love it.
really, really tremendous. And then once they hit that point, you'll crave it. You'll go, you know
Yes.
what? I don't know. I feel better. I'm in a better mood. I'm thinking a little bit better. I
Yes.
feel a little bit better. And you just have to get the engine going
Yes.
and then it'll take care of itself.
I love everything you said there. Sleep gets better. It all gets better, right? And yes, this is great. And baby steps, like that's the easiest way. We don't. Sometimes a lot of my clients have like all or nothing thinking. Like I'm either going to go to the gym for an hour and a half, or I'm not going to go. And that's really not going to serve us in creating health. We baby steps, small bits. I like exercise snacks. If you just have a
Yeah.
minute here, a minute there, do what you can. And I love the TheraBands idea too, because that's very not intimidating. It's inexpensive. Like pretty much anybody can do that. So I love that. Thank you. One of my last questions is, you have been such a big supporter of my work. We share patients. I refer to you and you refer to me, just so everyone knows. But I think it's because we both see the great outcomes. How did you get interested in as a conventionally trained, sports medicine physician? How did you become interested in functional medicine?
I think we both share a bit of a similar pathway in that we started in family medicine. But early on there was some echo in our head going, you know what, there's more to it than this.
Mm-hmm.
We're missing something. So for me, that branched into sports medicine, and then eventually that branched into what you were pursuing. But Well, I'll get right to a cool story. It was a couple of years ago, before you started doing this. I had a patient who, young mother, 37, 38, and you could just feel it when you walked in the room. You could feel the stress,
Mm,
right? And her right elbow hurt and her left knee hurt and her shoulder hurt and she had neck pain and all this stuff. And as traditionally trained doctors, we're trained to take that apart piece by piece,
mhm,
right? All right, here's I'm going to treat your elbow with this. I'm going to do this, and I'm going to do that. And at that time, it was like overwhelming for me to take her on to take on everything she was dealing with all at once.
mhm,
But I started to. I said, you know what? Let's take this slow and work on a plan. And here's what happened. It was, as we say in medicine, lost to follow up,
mm,
meaning she didn't come back. And I just thought too busy, whatever, too much going on. Well, anyway, about 2 years later, she came back, and when I walked in the office, there was a different person sitting there, and I could just feel the calm. And I looked, and I asked her, "What's going on?" And she goes, "I feel." I said, "What about A, B, C, and D?" She goes, "That's all gone. It's all gone." And then I sank down. You sink down into your chair, and you go, "Tell me." And she said, "I came under the care of a functional medicine doctor." And we started with my gut, and then we started with stress, and then the pain just melted away. Like all the pain problems are, that relationship is so complex, and you know that, and the body can't hide from itself. And what
mhm,
we as sports medicine call diagnoses are nothing more than the body's reflection of what's going on inside, whether it's gut and this was my one of my first, and I had to ask her, functional medicine, tell me about that. What is that? And she had to explain what was going on and what the doctor was doing. And I was just so overwhelmingly impressed by that. I was just bought in. And then I
mm,
started to learn a little bit about myself. And then from our side, we would realize what we don't know about this, right? But I don't know what to do. I know the gut microbiome is cool. I don't know a first thing to do about it, right? I know about some of these levels we can measure in the blood. I don't know what to do about it because that's not traditional medicine,
mhm,
right? Traditional medicine is this box of routine labs and routine stuff that is 100 years old, and that's where we're still living. Well, we've all got to move past that, and that's what
mhm.
functional medicine is doing. That's what I congratulate you for doing. And I have seen now the same results from your folks who come, they're almost like, yeah, I don't need you. I'm good, which is good for you. Yeah.
Well, well, thank you. I mean, I sent them to you for a reason, but yeah, I think we care for our patients in such a way that it's we make each other's jobs easy.
Yeah, for
Yeah.
sure.
Well, I just want to highlight that in really, congratulate you or just I'm excited for you because you said that she said I'm seeing a functional medicine physician, and you said I'm curious, what's functional medicine?
Yeah.
Whereas, truthfully, so honestly, the feedback a lot of my clients get is I mentioned that I was working with a functional medicine physician to my X, Y, or Z specialist, and they said, "Oh, you're wasting your time and your money." And they've lost that curiosity, and that's what I just love sending patients your way because I know that you have that open mind. You're always interested in other new ways, and so thank you for that.
Functional medicine is the front edge of what we don't know in Western medicine.
Mm.
That's my summary of it. It is finally opening the door into all the things that we either don't know or we're too ignorant to look at, to be honest. So
That's
keep
awesome.
up the good work.
Well, thank you. Thank you so much. So, my last question, because my podcast is called Push Pause to Heal, and I am on a mission to normalize rest in our society, I would love to ask you if you have a favorite way of slowing down and maybe how that's been important for you in your life.
Oh, that's an easy one for me. Mine's nature.
Mm,
Uh, and I love actually all the research that is around nature, the way
yes.
you literally ground yourself in nature. And there are things that happen. Yeah, I'll sound overly corny. I could sit in a field and listen to the wind blow, and it just sounds like it's speaking to you. I
Wow.
mean, we are so integrated with the environment, and there's so much healing that happens
Mm,
in nature, and so that's it for me. That's an easy
yeah.
one.
Well, that's good. It's a easy one to find in our day-to-day life, but honestly, a lot of us forget to go seek it. So thanks for that reminder to the listener that you can step out your door and healing can start happening. I love that. So if our listeners are interested in working with you, Dr. Ruane is in the Columbus, Ohio area. How can they find you?
Well, again, it's a mouthful. Our practice is called Spine, Sport, and Joint Center. If you look at it on Google, but just if you go to ohiohealth.com and find a doctor and either my last name, Ruane, or sports medicine, and that's where I live.
Awesome. We will link to that, to the practice and to you as well in the notes from the show today. So I can't say enough good things about the care you will receive if you want to work with Dr. Ruan and see if he can help unleash your body's healing potential even further. If today's podcast resonated with you, please help us share the amazing potential of the human body to heal when we care for it properly. So please share this episode and help Dr. Ruwan and I inspire and empower others to heal as well. Thank you so much for your time today, Dr. Ruwan. It was a pleasure.
I really enjoyed it. Thank you. I'm good to see you.
All right.